So for this video, we're going to talk about bone spurs. What are they? Are they a problem? Are they damaging your body? And do you need to get them addressed? So the first thing we need to talk about is what actually is a bone spur. Well, I have a couple of pictures of a bone spur. So this is a great illustration of what a bone spur looks like on x-rays. So you can see this looks absolutely terrible right here, and so does that. So normally this thing should be nice and rounded back here, and all should be well with the world. But what you're sort of seeing here is this is where the plantar fasciitis, which is a bunch of connective tissue that sits underneath the sole of the foot and helps support the arch, attaches right there on the heel bone. And you can see this sort of shadow here. This is kind of where the Achilles tendon kind of comes down and attaches right in through here. And you see all this nasty looking stuff. So there's a couple of things going on in this picture, but we're just going to talk about the spurs themselves. So this spur in this area, the only thing that it is showing you is that this bone, where that tendon is pulling and where this plantar fasciitis is pulling, there's a lot of stress on the bone. So there's a lot of tension here on the Achilles tendon. There's a lot of tension down here on the plantar fasciitis. And what happens is, just like going to the gym and working out, your bones grow more bone to accept the stress. Just like when you go to the gym and you work out, your muscles get bigger in response to the stress that you're putting them under. So these growths of bone called osteophytes are essentially, one, a shoring up of the bone to be able to better accept this force, and the other is because the pull is this direction, as this adds bone and it grows that bone out this way, what it's effectively doing is shortening this tendinous structure. So it's trying to lessen the tension on that area by basically bringing the origin closer to the insertion down here. Same thing kind of back in through this neck of the woods. So the idea is that bony spur growth just happens as a response to extra stress on the bone. So in this two-dimensional picture, it looks like, man, they are sharp and stabby, and they must be cutting and ripping apart things that are in your foot. Because look at this. Don't those things look super sharp? I mean, that's a terrible looking thing. It looks like a big old thorn sticking off the heel. The thing that's not really being well demonstrated in that particular picture is that is a two-dimensional picture of a three-dimensional object. So you are looking at the side of that, but if you were to flip that foot upside down and look at it from the bottom up, that is not going to be like a stalactite sticking out there. That is definitely going to be more like a broad, flatter type of spur. And the idea with that spur is, again, it's reacting to excessive stress on the bone, and it's trying to effectively shorten the distance between the origin and the insertion, thereby reducing some of the stress. So bone spurs, while they're not normal, right? They're taking up space. There's no indication from that picture, that x-ray, as bad as it looks, there's no indication from that picture that there's pain in that area. Those things take a long time to develop. It is not something that occurs in a week or a month or even 6 months, right? The development of a spur can take quite a bit of time. And as that develops, as that time passes, then there's no indication that all of a sudden one day it becomes painful. So much more frequently, the cause of the pain is the extra tension on that tendon that attaches to the bone. And if the tendon is under tension, that just means that the muscle itself is under tension. And muscles are one of the easiest things in the body to treat. So if you can get the muscle to relax and therefore not be as tight, then there's a whole lot less tension on the tendon, which means there's less tension on the bone. So in the area that there happens to be pain, that doesn't mean the spur itself is the cause of the pain. It just happens to indicate that there has been excessive stress in that area for an extended period of time, and the bone has changed itself to better accept that stress. That is all that means. It is not causing your pain necessarily, it just happens to be in the location of your pain. So as to whether or not you need to get a spur surgically removed, that's a little bit of a different conversation. The first thing that I would say is try to do all the non-invasive options first. That could be physical therapy, could be chiropractic, could be acupuncture, massage, a bunch of different things that you can try that are not necessarily invasive. So if you've exhausted all of your options and you've not been able to alleviate your pain, then having those removed is an option, but try to do all the rest of this stuff first, because surgery is always going to be there for you as an option. Nobody's going to take it away. It's always there for you, but it's also kind of one of the most invasive and has the greatest chance of potential side effects and adverse reactions than any other non-invasive treatment that you can try. If this helps gives you a better appreciation of what a bone spur is, what it means, why it's there, and does it cause pain, give me a thumbs up if there's somebody that you think could use this information to help them with their education and just, I've got these bone spurs, I'm thinking about having some surgery. If you want to share this with them so that they have a little bit of a different insight about what is causing those bone spurs, then that would be appreciated as well. Subscribe. I've got a bunch more videos coming out that are already on the channel. There's going to be more to come on a variety of different orthopedic issues, and give us a subscribe if you like it. Thanks so much.